Hi friends, this is Dr. Kashish Grover. Welcome back to the episode 2 of the final 15. And the topic for today was nutrition and NCD. I hope you gave the quiz in my Telegram channel. The Telegram channel is @case_PSM. This is my Telegram channel where we conduct daily quizzes. And the topic for today's quiz was nutrition and NCD. The first question: in a food safety training, a milk vendor asked about methylene blue reduction test. Methylene blue reduction test. So methylene blue test, guys, I want to tell you about test of milk. If I talk about the test of milk, number one is before pasteurization. Before pasteurization. The test which is done before pasteurization is known as methylene blue test. It is known as methylene blue test. And there are some tests which are done after pasteurization. Some are done after pasteurization. What are they? Number one, phosphatase test. Number one is phosphatase test. Number two, coliform count. Coliform count. And number three, standard plate count. Standard plate count. So these tests are done after the pasteurization, and the test which is done before pasteurization is methylene blue test. Now, what is methylene blue test, guys? Whenever the milk is acceptable for the pasteurization, right? So we add the methylene blue reagent in the milk. Now, if the bacterial load is very high in the milk, this converts the blue color back into the white color. So, if suppose from the time taken from blue to white is 5 hours, and suppose second milk sample, the time taken from blue to white is 20 minutes. So, the one milk which is taking less time to be back in white color, it is full of bacteria, because these bacteria, the high load of bacteria, they consume the reagent and convert it back into white. I have already discussed this in my classes and DVT. Now coming to the next question. Before I go to next question, I want you to take a pause the video, and just let me know, are you guys attempting the quiz? What was your score today? So this is my suggestion. Please write in the chat box, pause the video, write in the chat box what is your score today, right? What is your score today? And are you using the PDF tracker? Are you marking the PDF tracker? Okay, now coming back to the question. A family is consuming one boiled egg daily. What is the energy value for one medium-sized egg? Guys, egg follows something related to 6. I have told this in my class. Egg is related to 6. How? One egg is 60 gram. It gives 60 kilocalorie, somewhere around 60 to 70 kilocalorie. 6 gram protein, 6 gram fat, and 30 is the calcium. And 30 is the calcium, 30 microgram calcium, right? So here the best answer is 70 kilocalorie. The best answer is 70 kilocalorie. 28-year-old pregnant woman in her second trimester is enrolled in antenatal care clinic according to ICMR daily RDA. Guys, listen. Non-pregnant, non-lactating. Non-pregnant, non-lactating, a woman who is not pregnant, non-lactating in reproductive age group, needs 29 mg iron daily. A woman who is pregnant needs 27 mg daily. And a woman who is lactating needs 23 mg daily. Guys, This is the update according to the ICMR guidelines. This is the update. So here the best answer is 27 mg, and 40 mg was mentioned by the old guidelines. The old guidelines, they mentioned 40 mg. Why? The guideline mentions that in pregnancy there is no menstruation, there is less blood loss. That is why RDA is less than a woman who is non-pregnant, non-lactating in reproductive age group. 60-year-old male from India presents with chronic hemoptysis. This was just the history to distract you. The main question is written here. According to the ICMR, most common cancer in India, guys. This I have already told you. See, there is a Globocan. Globocan is WHO. WHO Globocan says most common cancer is male is lip oral cavity. They say in female it is breast cancer. But few months back there was a study which ICMR published, and ICMR told that among men the most common cancer is lung cancer. I told you in my class and DVT as well. If they mention ICMR, it is lung cancer. If they mention Globocan, it is lip oral cavity. If you do not mention anything, then the answer should be lip oral cavity. But if they specify ICMR, then the answer should be lung cancer in male. And what about female? It is breast cancer. Right? So please, no confusion. I'm talking here about Indian data. Public health worker is recording blood pressure and waist circumference. So which is WHO step? Guys, WHO steps approach. WHO steps. This is done for NCD risk factor. This is done for NCD risk factor. Now, step 1. In step 1, what we do, suppose this is the whole village. We go to the village and we use a form and fill the form, and that is known as behavior. In the form it is mentioned how many times the person consumes alcohol. In the form it is mentioned the age, so these risk factors are present. If anyone is found to have any risk factor on step 1, we take that person to step 2 and we ask the person for the measurements, physical measurements like the one which is being done here, BMI, waist circumference, right? If anyone is found high risk on BMI, if the BMI is increased, waist circumference is increased, then we go to the step 3. Step 3 is known as biochemical. Now we ask the person to give the blood sample to check for the lipid profile, HbA1c, and other biochemical parameters. In this situation, the correct answer will be step 2. Now, coming to another question, we have already discussed this above. So the answer here will be behavior risk factor questionnaire. Health officer explains that 50%, guys, listen, this is rule of half. Rule of half says if this is the whole population, 50% is hypertensive, 50% is hypertensive, and those who have hypertension, 50% they know they have hypertension, they are diagnosed. Those who are diagnosed, 50% of them are taking treatment. Those who are taking treatment, 50% of them are only adequately able to control the blood pressure. This is rule of half. Guys, please note, rule of half is only and only for hypertension, right? It is only for hypertension. You cannot say this is for all non-communicable diseases. Why? Because non-communicable disease is a wide range. 50% are not diabetic, 50% don't have cancer, right? But yes, 50% do have hypertension. So this is rule of half, and this is rule of half, and this is for hypertension. A man on maize predominant diet presents with diarrhea, dermatitis over sun exposed areas. Simple. I think this is the most easy, most simple question in chapter nutrition. Right? So this is niacin deficiency. Niacin is B3. We see diarrhea, dermatitis, dementia, diarrhea, dermatitis, and dementia. Diarrhea, dermatitis, and dementia. This is vitamin B3. Now, dermatitis is seen over sun exposed area. Dermatitis is seen over sun exposed area. There is a typical pattern seen over neck. Can you name that pattern in the chat box? So I have given you two homeworks till now. Number one is tell me the correct score out of 15 which you got today in the quiz. And second homework now. What is the classical pattern of the dermatitis seen over the sun exposed area in niacin deficiency? Old, alcoholic, person, ataxia, confusion, ophthalmoplegia. Which vitamin deficiency? Guys, alcohol is seen mainly in Goa. So alcoholics, they get a disease which is known as Wernicke's encephalopathy. Wernicke's encephalopathy, G stands for global confusion. Global confusion. O stands for ophthalmoplegia. Ophthalmoplegia. And A stands for ataxia. A stands for ataxia. These three are the symptoms. Why Wernicke's is happening? Because chronic alcoholic, they develop thiamine deficiency. They develop thiamine deficiency. Right? They develop thiamine deficiency. Several individuals from same locality, bilateral pedal edema, breathlessness, history of consuming mustard oil. I told you a mnemonic for this situation, and the mnemonic is a drop of mustard oil. A drop of mustard oil. So this is epidemic dropsy. Epidemic dropsy. In epidemic dropsy, the mustard oil is contaminated with argemone oil. And the toxin is sanguinarine. Clinical features: bilateral edema. Clinical features are bilateral edema, pedal edema, bilateral edema, glaucoma, diarrhea, and congestive heart failure. Epidemic dropsy is the correct answer. 30-year-old, and this is the case of Lathyrus sativus toxin. This is the case of boa. When kesari dal is consumed over 3 to 6 months, then the person develops neurolathyrism. Right? This is because of boa, beta oxalyl aminoalanine. Beta oxalyl aminoalanine is the toxin present in the kesari dal, which is known as Lathyrus sativus. 30-year-old women, guys, the requirement for protein is 0.83 gram per kg. 0.83 gram per kg. This woman is of 55 kg, multiplied by 0.8, you will get the answer 44 gram of protein. 44 grams of protein. That is why the correct answer here is 44 gram of protein. Now, these were the 15 questions in today's quiz. It is time to revise 15 very important one-liners. Best protein quality indicator. Guys, best protein quality indicator is DIASS. DIASS. Right? Digestibility indispensable amino acid score. DIAAS. Right? DIAAS. Coming to energy requirement, the female requires 1600, 2100, 2700 kilocalories. This is sedentary, this is moderate, and this is heavy worker. The moderate female energy is required by a sedentary male. Sedentary male requires 2100, 2700 by moderate, and 3400 kilocalorie and 3400 kilocalorie. So this is the energy required by different type of workers in both the genders. Tracking of blood pressure is, if we track blood pressure from childhood, if blood pressure from childhood to adulthood is tracked, then if anyone is having low blood pressure in childhood, that person, when he will grown up into an adult, will be having low blood pressure in adulthood. This concept is known as tracking of blood pressure. Toxin in khesari dal, we have already discussed. BOA. Vitamin preventing neuroletharism, it is vitamin C. Wernicke's encephalopathy, we have already discussed. GOA. We have already discussed the mnemonic is GOA. And which deficiency? B1 deficiency. It is B1 deficiency. Test of pasteurization, we have already discussed 3 tests of pasteurization: phosphatase test, standard plate count, coliform count. Guys, what is 90-70-90? This is for cervical cancer. 90% women should get the vaccine for cervical cancer, that is HPV vaccine. 70%, I said 90% of women, no, 90% of the girls, right? 70% women should be screened, and 90%, if anyone positive on cervical cancer, maybe pre-malignant lesion, should get the treatment. Epidemic dropsy, most sensitive test is paper chromatography. This is NEET-PG 24 question. Paper chromatography is the most sensitive test for epidemic dropsy. What is the another test for epidemic dropsy? That is the nitric acid test. Which is most commonly used? Nitric acid test. These two tests are used for epidemic dropsy. Indicator used for iodine surveillance: urinary iodine excretion. For the surveillance purpose, urinary iodine excretion is used. FSI under which ministry? Ministry of Health and Family Welfare. This is Food Safety and Security Authority of India. RDA covers how much population? 97.5% population. It is not 95%, but it is 97.5% population, right? It covers mean plus 2 standard deviation. Please mind here, I am not writing mean plus minus 2, I am writing mean plus 2 standard deviation. It covers 97.5% population. Zinc deficiency causes, the mnemonic here is DAD. It is diarrhea, alopecia, dermatitis. The dermatitis seen in zinc deficiency is classically periorificial. The child gets the rashes around the mouth and around the genital area, around the anal area. Consuming raw egg causes biotin deficiency. The raw egg contains a compound which is known as avidin. Avidin inhibits biotin deficiency and the person get hair loss. A person get hair loss. Hair girls would agree with me. Some of the shampoo they are advertising it by saying this is biotin rich because biotin protect the hair. Coming to the last one liner here, plus F. This logo is for fortified food. Any fortified food in the market will now be having plus F logo. With this, I end this session. I hope the concepts are clear. See you tomorrow in my Telegram channel, Ks_PSM, with the day 3 topic. So what we have to do, you start your day, whatever time you have allotted for PSM, you start your day with the tracker, read what is the topic, right? Attempt the Telegram quiz, watch these revision sessions, open your PDF tracker, which I have shared again in my Telegram channel, and mark there what was your weak topic, what was your main weakness in these chapters. And don't forget to stay consistent and subscribe this YouTube channel. Thank you so much. If you have any doubt, you can ask your doubts. You can ask your questions in the comment box. Don't forget to like this video and share it with your friends. Thank you so much. This is Dr. Kashish Grover, your PSM faculty, signing off.